This is NORC's submission to the HHS Medical Bill Redesign Challenge. In our redesign of the medical bill and billing process, we identified three main obstacles that impede patient satisfaction. Patients do not fully understand the billing process. The costs for procedures and the nature of services provided are not clear. Patients receive a high volume of communications from insurers and providers, and these documents are not standardized in terms of visual design and information presented. Our solutions to address these obstacles include the option for patients to assign their visit a personal name when they make the appointment that will label the visit throughout the billing process, a progress timeline that shows patients where they are in the process, the creation of pre- and post-service visit documents by healthcare providers that include the visit name, estimated and actual costs, and non-technical descriptions of services rendered, and standardized visual design and clear display of next steps on all bills and explanation of benefits documentation. Let's look at how these elements are implemented in the case of our fictitious patient John Doe after he has hurt his leg falling off a horse. After an initial visit and follow-up, John receives a final bill for the visit he named follow-up on May 12th. This document prominently displays the visit name in multiple places, allowing the patient to clearly link the document in front of them with their healthcare experience. It contains the progress timeline. In this case, the bill is in the last stage and ready for payment. In addition, there is a non-technical description of services rendered. The current status box makes it clear to the patient exactly what their next steps should be. On the next page, previous visits to that provider and their status are also shown. Payment options for this bill are displayed as well. After being referred to a specialist and having an initial consultation, John goes in for cold laser therapy treatment on his knee on October 22nd. Before the visit, John receives a pre-service estimate of what will be done and what it will cost. After this, the patient receives an explanation of benefits from the insurance provider. The first page of this EOB shows all the visits the patient has made that have been referred to this insured during the year and their current status. The next pages show more detailed accounts of visits to the most recent provider, the specialist Dr. Cowley. These include descriptions of services rendered and summaries of charges, plan discounts, and amounts covered by insurance. Finally, on the last page of all these documents is a series of tables that provide a description of terms used in the progress timeline and who to contact with further questions.